y'all gotta say, I don't know when.
Just whenever you start out.
Me too.
Okay.
Go off of my mom's count.
Today I'm going to be performing my catheter insertion skill. I would first start by verifying the doctor's orders. Once I did that, I would then look into my patient's medical records, seeing if there's any urinary strictures that would cause any complications when I place the urinary catheter. I would then go into my patient's room, close the door to ensure privacy. I would perform hand hygiene. I would introduce myself. Hi, my name is Sierra. I'm going to be your nurse today. Can I get your first and last name and date of birth? I'm going to identify my patient with 2 identifiers. Once I do that, okay, her name is Hannah Martinez. The date of birth is 7/21/95. Okay, Miss Martinez, do you have any allergies that you're aware of, specifically to latex, iodine, or shellfish? No? Okay. We are going to be placing a catheter in you today to go to release some of the tension in your bladder. Do you have any questions before we get started? No? Okay, I'm then going to raise my patient's bed to a comfortable working level for me. Once I do that, I'm going to remove my patient's pillow and place her in a dorsal position. I'm just going to examine her bladder. I'd either do it with the bladder scan or palpating it. The bladder scan is going to tell me how much fluid is left in the bladder, and just palpating it for any distension. Once I do that, I'm going to get my supplies, get it all together. I would then perform hand hygiene because I'm going to clean my patient. Let me remove this real quick. So I would hand hygiene again. I'm going to place some gloves on. I'm going to get a wipe or a towel with soap and water. Oh, before I do that, let me put an absorption pad under my patient. I would just ask her to lift her thighs up. If she was older, I would prop her hips up just to help her with the help with the placement of the catheter. But we're not gonna prop her up today. We're just gonna. She's young and vibing. So I'm just going to get a towel, wrap it around my hand. I am going to spread the labia. I'm going to wipe the furthest one away from me. I would then change let me start over, right? No, don't start over, but let me start over. I'd get a towel with soap and water. I would just wipe the labia, the furthest away from me, change my towel's position, wipe the other labia, change my towel's position, and down the middle. I'm going to disregard of my gloves, and I would perform hand hygiene again. Not miss those labies. So once I do that, I am ready to open my catheter. My patient is comfortable still. I'm going to I'm going to inspect my catheter kit, making sure it's not broken and the seal it's still sealed. I want to look for the expiration date, make sure that what the doctor ordered is what I have. So I'm going to then open my catheter kit, and I'm going to remove it, and once I remove it, it is not sterile. I'm going to use this as a trash bag so my hands don't fall below my waist and remain in the sterile field. I'm just going to disregard that. I want to open it away from me, so I'm going to go there. Move those. I'm only touching the 1 inch into the thing, then I'm going to turn it this way. I'm going to use the crane method and pick all this up. Once I do that, I have my sterile gloves. I'm going to disregard of the triangle one, and I'm going to place this absorption pad shiny side down on my patient. Again, I just ask her to lift her legs, lift her hips. Okay, I am now going to scoot this over a little bit. Get my sterile gloves ready. Oh, perform hand hygiene before I put my sterile gloves on. I don't have a lot of room, so let's see. Only touching 1 inch into the paper. and I can touch it because it's sterile to sterile. Then disregard of that, I'm going to scoot this back in. Oh, I need to touch the inside of it because I am sterile, so I need to touch here. I'm just going to turn this way. Move that there. I'll start by getting the iodine, placing it on the cotton balls. Once I do that, discard of that. Then I'd get the lubricant and put it there, and then discard of that. I'm gonna place this, oh, I need to remove the sheath of the catheter. I wanna hold on to it just so it doesn't wiggle everywhere, and disregard of that. I'm gonna place this back on there. Oh, I am also going to attach this to the water. Remove that. Okay. Remaining sterile, I'm still gonna touch the inside of this. We're gonna go to the patient's bed now. Making sure my patient is still comfortable. And only touching inside of the parameter, not the 1 inch, because I am sterile now. I'm then going to take this hand, and once I touch the patient's labia, it is not sterile, so I'm going to take it, lift and pull. I'm then going to get my little pinchers and my cotton balls, and I'm going to start cleaning with the side furthest from me. So I'm going to go swipe down, discard the side near me, swipe down, discard. I'm going to down the middle, discard, and with the rest of the cotton balls, I'm going to continue cleaning, exposing the meatus. Discard, and with my last one, I'm going to discard that. I'm then going to get my catheter, put it in my lubricant, about 2 to 5 centimeters, depending on if it's a male or female. I'm going to place my hands pulling. I'm going to place the catheter in the meatus. Slowly walking my hand back. Once I see urine, I'm going to go about another inch in. I am then going to, with this hand, hold the catheter, inflate, pushing the solution into the balloon. I would then pull back, making sure it's secure. I'm going to remove this, disregard. I am now unsterile, so I am going to get my patient's bag, go over the leg because I don't want to go under, place it. I don't have a clip, but I would, nope, it didn't stay, but that would not happen because it would be inflated and it would stay. I would then place it under there, or clip it to the bed rail, and I would secure it to the patient's leg with some tape that I have in the wrong hand. And it's kind of not working for me. And then I'm just going to disregard of all my supplies. Properly. So I would throw those in the trash, disregard of my gloves properly, perform hand hygiene. I would ensure my patient's comfortable, the bed is low, locked, and the call light is near. Miss Martinez, is there anything else I can do for you? Are you feeling okay? I would also make sure all her personal items are close to her just so she doesn't have to get up. If you feel any discomfort or anything, go ahead and press that call light and give us a call, okay? And that is my video.